to our channel. Today we are going to discuss on the topic posology. What is posology and what is the use of the posology? Like the same drug, same disease, but one patient gets 500 mg and other gets just 150 mg. Why? This is because the dosing of medication is not a guesswork. It is a precise science called the posology. In today's chapter, we will discuss in detail. Why does not everyone get the same dose? Same drug, same disease, but one patient gets 500 mg and the other gets just 150 mg. Why? Because dosing is a medicine, it's not guesswork, it is a precise science called posology. In today's video, we are going deep, the full definition, every type of dose you must know for your exam, all the factors that affect dosing, and every single formula for calculating the dose by age, by body weight, and body surface area. What is posology? Posology is a branch of medicine and pharmacy that deals with doses of drugs, specifically the calculation of the correct quantity of a drug that should be administered to produce the desired therapeutic effect without causing toxicity. Etymology means the terms comes from the two Greek words, posos meaning how much and logos meaning studies or science. So literally posology, the science or quantity, or more practically the study of dose. What is dose? Dose is defined as the quantity of a drug administered at one time to produce a desired pharmacological or therapeutic effect in the body. Doses are usually expressed in weight in mg, milligram, in gram or mc, microgram, and in volume ml, liter, in units like for insulin 40 units, 20 units, vitamin D. Why does dose matter so much? Every drug has a narrow window between being ineffective and being toxic. Give too little and the patient does not get relief. Give too much and you risk serious adverse effect or even death. This is exactly why the posology exists as a formal science within the pharmacy to standardize and individualize the product. A dose response scale from low to high is the minimum dose. It is the smallest dose producing a therapeutical effect, and a maximum dose, it is the maximum dose safely given to an adult without producing the toxicity or side effect. Third is the therapeutic dose. It is in between the minimal and maximum dose. This is generally the prescribed dose physician prescribed to the patient. Toxic dose, the dose that exceed the maximum dose and produce symptoms of poisoning or toxicity without necessities being fatal. Next is the lethal dose. The dose that is the large enough to cause death. In pharmacology, you comes across LD50, lethal to 50% of a test animal population. This is important in toxicology and drug safety studies. Initial dose or loading dose, a relatively larger first dose given to quickly achieve the desired therapeutic drug concentration in the blood, especially for drug with a long half-life like digoxin is loading dose. Next is the maintenance dose, the dose required to maintain the desired steady constant state drug concentration in the blood given after the loading dose. Usually it is smaller and repeated at an intervals. Then divided dose, when the total daily dose is split into smaller portion given at intervals like twice daily or 3 times or 4 times daily to maintain consistent blood levels through the day. Next is the priming dose. Priming dose similar to the loading dose, an initial dose given to the prime or saturate the tissue before starting maintenance therapy. The factors affecting doses. Now, why cannot the same dose work for every patient? This is where the factors affecting dose comes in. Another very exam questions and important question for exam. Various factors affecting age. Infant and children have immature liver and kidney functions, so drugs are metabolized and excreted more slowly, then generally need lower weight adjusted dose. Elderly patients also have reduced organ function and often need reduced dose. Second is body weight. Heavier individuals generally have a large volume of distribution, so many drugs, especially those doses per kg, require higher absolute dose in patient having more weight. Next is body surface area. It is used when a very precise correlation with the metabolic rate is needed, critical for narrow therapeutic index, drug like anti-cancer chemotherapy agent. Next is the sex. Women generally have a higher fat to lean body mass ratio, lower body weight on average, and hormonal differences like menstruation, pregnancy, lactation that can alter drug metabolism and required dose. Next factor is pathological condition or disease state like liver disease, that is cirrhosis, impairs drug metabolism, and kidney disease impair drug excretion. Both require dose adjustment, usually downward, to prevent toxic accumulation. Next is the genetic factor or pharmacogenetics. Some persons or individuals are fast metabolize and others slow metabolize of certain drugs due to genetic variation in liver enzyme. Like CYP cytochrome P450 variants make patient fast or slow metabolism. Next is drug tolerance. Repeated use of certain drugs like opioids can cause the body to require increasingly higher dose to achieve the same effect. Next is the drug interaction. Concurrent use of other drugs can either enhance or inhibit metabolism effect requiring dose adjustment. Next is the time and route of administration. Some drugs are dosed differentially depending on whether given before or after meals at a specific times of the day, which affect absorption and hence the effective dose. Next is psychological factors. Patient compliance, placebo response, and even the patient's mental state can influence how a standard dose performs in practice. Out of all these three factors, you as syllabus specifically want you to calculate method. Now we comes to the core topic. The different way to calculate the dose or the different formulas. First is according to age. It comes having the Young's formula, Dilling's formula, Clark's formula, and pediatric rules. And second is the by calculation of dose by the body weight. It is the most common methods in ICU and pediatric patients. And the body surface area is the third. It is the most accurate used for anti-cancer drugs. Now we comes in the detail. First is dose calculation by the age. Rule 1 or a Young's formula. The Young's formula is for the children having 1 to 12 year of age. It is based on the age. The formula is child dose is equal to age divided by age plus 12 multiplied by adult dose. Assume an adult is fully grown for dosing purpose at approximate age of 12. So 12 is added to the children's age in the denominator. Example, a 6-year-old child and adult dose is 500 mg. Then uh, putting the values in the formula and answer is 166.6 mg for a patient of 6-year age whose adult dose is 500 mg. Another example is 3-year-old child adult dose 300 mg, so 3 by 15 multiplied by 300, that is 60 mg. Formula number 2, dose by age. For children above 4 years of age, it is based also on the age. The formula is children dose equal to age divided by 20 multiplied by adult dose. It is assuming an adult reaches full dosing maturity at age 20, applied generally to the children above 4 years of age. Example of this, 8-year-old child adult dose is 600 mg. 8 by 20 multiplied by 600, the dose comes 240 mg. A 15-year-old adult dose is 500 mg, then answer comes to the 375 mg. Now the next formula, which is the Fried formula or Fried rules. It is for the infant. It is based on the age in months. It is for the children under 2 years. Infant dose is equal to age in months divided by 150 multiplied by adult dose. Age in month given a more precise function than years for very young infants, specially meant for the infants under 2 years of age. The example is 12-month-old infant adult dose is 300 mg. Then answer is the 24 mg. If 6-month-old infant adult dose is equal to 400 mg, then 6 by 150 multiplied by 400, the answer is 16 mg. Now the next formula, which is according to the body weight, it is called the Clark's formula or Clark's rules. It is based on the body weight of child in pounds. In LBS, the formula is child dose equal to weight in pound divided by 150 multiplied by adult dose. 150 pounds, about 68 kilogram, is taken as the average adult weight. Convert kg to pounds by multiplying the 2.2 if needed. If you have given the weight in kg, then you have to convert it in the pounds to apply this formula. The child weight is 30 pound and the adult dose is 500 mg, then the answer will be the 100 mg. And if the child weight is 45 pound and adult dose is 650 mg, then answer is the 195 mg. For is another formula of dose by the body weight. The most widely used clinical method according to body weight. The body weight is in kg. The formula is dose per kg multiplied by body weight. Why it is preferred? Two children of the same age can have very different weight due to nutrition or health status. Body weight correlates far more closely with the drug distribution than age alone, which is why hospital prescription write doses as mg per kg in some cases. And in rare cases, the formula of according to weight is preferred. Work example, drug at 10 mg per kg and the patient weight is of 25 kg, then the dose will be the 250 mg. Thank you. Now we have the formula according to the body surface area. It is in two methods or two steps. This is the most accurate dosing method essential for narrow therapeutic index drugs like anti-cancer chemotherapy, where body surface area correlates with the other factors of the body. Firstly, we have to apply the Mosteller formula or calculate the BSA, body surface area. In the formula, this formula is BSA, body surface area meter square, is equal to root square of height in centimeter multiplied by weight divided by 3600. Example, if a person height is 150 centimeter and weight is 40 kg, then results comes to 1.29 meter square. And sometime a graph chart is also used, in which the height and weight scales joined by a line crossing the BSA scale is comes. And the one formula is also used, which is the Du Bois formula. It is the historical gold standard reference formula only. Uh, the given formula is 0.00718 multiplied by height centimeter in 0.725 and weight in kg. Then putting the values, if a person height is 160 centimeter and the weight is 65 kg, then this comes the 1.82 meter square. But Mosteller formula is simple and fast by hand, that's why exam favors it. Now in step 2, the calculating the dose according to the body surface area. Its formula is the patient dose is equal to body surface area divided by 1.73 multiplied by the adult dose. For an example, if a children body surface area comes 0.9 meter square and the adult dose is 500 mg, then putting values in the formula, it comes the 260 mg. Then what is why we take 1.73 meter square? Because it is the accepted average body surface area of a standard adult, and this is an important question, directly can be directly asked in 1 marks question in examination. Now we have a summary of the formulas we have learned. The first is the Young's methods, Young's formula, which is used for the according to the age. The formula is age divided by age plus 12 multiplied by the adult dose. It is used for the children's having age group is 1 to 12 years. And second is the dealing formula, in which age divided by 20 multiplied by the adult dose. It is for the children's above the age of 4 up to 80. Then the Clark's formula, it is according to the body weight, weight in pounds divided by 150 multiplied by the adult dose. This is for the pediatric and weight based. Fried formula, this is according to the age, but it is for the neonates who has age in month. Age in month divided by 150 multiplied by the adult dose. This is for the children or infants under the 2 year of age. Then according to the body weight methods, the dose divided by kg multiplied by the body weight. It is for the pediatric ICU critical care, and it is for the body weight. Then the body surface area calculating formula is the square root of height multiplied by weight divided by 3600. And BSA dose formula is body surface area divided by 1.73 multiplied by the adult dose. It is used for the most accurate for anti-cancer drugs and high risk drugs also. Thank you for watching. Please like, subscribe and share and turn on the notification. We will covering the entire general pharmacy syllabus topic by topic. Drop your doubts in comments. I read every single one. And the topic of choice you want to be